This is Lynn Fitzgibbons with a fifth COVID-19 community update, variants, vaccines, and back to purple. We'll look at the community condition. We will talk about the changes in our regional stay-at-home order this week, talk about variants, touch on vaccines, and finish, as always, with pearls for the week. Starting with a look at our community's condition, I'll open by pointing out that I think there is some reason to be optimistic. Here we see the percent positivity from October until this week. Percent positivity, remember, is the percent of all tests that are being done which are positive. Back in October, right around 2%, only 1 out of every 50 tests. And of course, a quite remarkable peak around the start of the new year with 16–17% of tests done in Santa Barbara County which were positive. The great news, as you can see, is that over this last 1 to 2 weeks, we have absolutely seen a downturn in this curve. We still remain in the region that qualifies us for purple tier based on percent positivity, as you can see from the background, but absolutely, I think, evidence that we have started to trend in a positive direction. When we look then at the actual number of new daily cases reported to our public health department, in the green jagged line, we see, of course, a similar trend. We see a very, very concerning 2 weeks ago peak of almost 800 new cases diagnosed in just a single day. But since then, we've seen a downturn. We've seen an improvement. We still have far more cases diagnosed every single day than we really had at any point over the summer. But I think as you look at the red average line there, again, just as with percent positivity, I think we are seeing a very reassuring downturn. We know, of course, that hospitalizations lag the case rates and percent positivity. Changes in the prior two graphs are going to take usually 1 or 2 or even 3 weeks to show up in this graph. This graph is going from back in April until this week and looking at the number of people in Santa Barbara County who are hospitalized with COVID-19. Unfortunately, we still have approximately 200 people across our county hospitalized with COVID-19 this week. But the good news, again, is that that curve may be starting to stabilize. Unfortunately, still 50 to 60 people in the ICU with COVID-19, but again, those curves may be starting to stabilize. Our ICU capacity as a region, everyone remembers, dipped below 0 in mid-December. And the indication from the governor's office in news this week is that the 4-week projection at this point suggests that that red curve that is currently below that baseline will be above the 15% line within the next 4 weeks. Very, very good news. When we then look at the adjusted Santa Barbara County ICU capacity, we've really hovered right around 0, with the actual ICU capacity, of course, hovering right around 15%. Again, as the region anticipates some improvement and as our case counts are slowly improving, I think the hope would be that we do start to make some progress on this graph too. Weekly deaths, unfortunately, are a different story. We know that deaths are going to lag by 3, 4, even 5 or 6 weeks after a change in the case counts across the county. We saw a record-breaking number of people diagnosed with COVID-19 2 and 3 weeks ago. And unfortunately, we know that we're yet to really feel the impact of that on our death counts. Here you see the number of deaths diagnosed per week, the number of deaths that occurred per week from September, October, November, December, and then January. And again, I think just remarkable and tragic to see literally dozens upon dozens of Santa Barbara County residents losing their lives to this disease just even in the last 4 weeks. And so what changed this week from the governor's perspective? We're told that 4-week projections of ICU capacity across the state, but more specifically across the region of Southern California, were very optimistic. In fact, the projection was that the percent ICU capacity was to exceed 15% in the next month. And so the regional stay-at-home order was lifted yesterday. That, of course, does not mean the pandemic is over, but rather it returns us to the Blueprint for a Safer Economy framework, which is the color coding system. Remember that back in early December and in November, we were, of course, in the purple tier, having enjoyed some number of weeks in the red tier in the fall. The purple tier is one of the 4 tiers, the most restrictive of the tiers, and by definition, purple tier counties have ongoing widespread transmission. The tier assignment is based on test positivity as well as daily case rates, both of which currently for Santa Barbara County qualify us as being purple, with 73 new COVID-19 cases per day per 100,000 residents this week, with the adjustment being 49 cases. And our test positivity, 13.3% currently. So again, we remain in purple, but that extra restriction, that more intense restriction of the stay-at-home order has now been lifted. Looking again at the daily new reported cases, I bring your attention to the lower line with the mark 32. This is the threshold under which we need to drop to return to red. Again, just a reminder, while certainly good signal that we have been removed from the regional stay-at-home order, that intense set of restrictions, we of course still remain very squarely in purple and likely many, many weeks or longer before our curve would improve such that we would be under that threshold of approximately 32. Let's talk briefly about variants then. To bring everyone back to high school biology class, I'll remind you of what SARS-CoV-2 virus does. It has these spike proteins, these red proteins around the outside that bind to our own cells. This big blue circle is our own cell, and it binds via a receptor called the ACE2 receptor. It then enters the cell and it unpacks the code that it carries, the RNA it carries, and that code is how the cell then makes a new virus. Viral proteins are then assembled, and then a new virus is essentially born and can go on to infect the next cell. When we think about variants, we have to remember that with every one of these cycles, there are minor changes in the RNA occurring. In fact, with every single new virus that's made, small changes can happen, and these small changes are called mutations. Most of these small mutations don't really change how the virus behaves or functions, but some do. If a mutation makes the new version of the virus weaker or perhaps less good at infecting the next cell or the next person, then this new version will likely be beaten out by the original virus that didn't have that mutation. If, however, mutations give the new version of a virus an advantage, perhaps makes it more infectious, perhaps makes it attach to that ACE2 receptor tighter, or do other good things that makes that version of the virus really have an advantage, then it will essentially potentially beat out the original virus, which didn't have that mutation. And so if a mutation or a group of mutations happen in a really important part of the code or the RNA, such as the part that codes for that critical spike protein, then that new version of the virus can slowly take over as perhaps the most fit or the strongest version of the virus in a community of people or in a country or perhaps across the world. And we call that new version of the virus with that set of mutations a variant. So what do we know about variants? We know that new variants are occurring all the time. Most are not important, but some are very important. Variants that have changes in the spike protein in particular could be more infectious. They could be more likely to cause severe disease or death. Unfortunately, they could increase the risk of reinfection. If my body learns how to deal with one version of the spike protein, but then a year later, I'm infected or exposed to a different version of the spike protein in the form of a new variant, then my antibodies and my cells might not recognize that spike protein and might be prone to becoming infected or reinfected. The other concern, of course, is that changes in the spike protein in a new variant could mean that the vaccines that we have developed against older variants may be less effective. And so there are several really important variants currently being talked about in the media. There's the UK variant, the B117. And the UK has really had a robust system in place to monitor for variants. They had a smaller percentage of B117 in September, and then they noticed a very big increase by December. And when this was looked at, it was concluded that a set of changes in the spike protein probably caused this variant to be more infectious. There's also, unfortunately, this week, some information to suggest that B117 may actually be increased with a small but important increased risk of death. And then as the world started to look for variants, and B117 in particular, several other new variants have been investigated and really uncovered and better understood. Researchers in South Africa identified another variant after doctors there discovered a real jump in COVID cases in October. And they alerted the WHO in early December that this variant has some mutations that may make it less susceptible to vaccines. Again, some data on this week that while it does look like the vaccines we have are probably still effective against the South African variant, there's some indication that they may be slightly less so. Of course, a variant found in Brazil has had some of the same mutations as the South African variant, and a case of this variant was found here in the United States just this week. Much work's been done in California looking for B117. It's been found in a few California counties, Los Angeles, San Diego, and San Bernardino. But in most recent reports, it still doesn't appear that B117, the UK variant, is a major player in California. Rather, as they have looked for B117, a group out of UCSF, a group out of Cedars-Sinai, and a variety of other big academic and public health groups have uncovered a large number of a new, perhaps California-specific variant. This variant's been found elsewhere before California, but the Cedars-Sinai group reported that the California variant had been barely detectable in samples they looked at back in October, but by late December, about a quarter of the samples they tested were indeed this new California variant. And there another report that up to 36% of the samples tested in Los Angeles were this new variant also. And so one theory is that the California variant may be at least partly responsible for the devastating surge that we felt in Southern California over the past couple of months. What we need to know is, of course, whether these variants are circulating in high concentrations across the United States, in California, and ultimately in Santa Barbara County. We need to know about these variants. We need to know whether they're more infectious, cause more severe disease, increase the risk of reinfection, or decrease effectiveness of vaccines. We need both lab-based information, as has been reported thus far, but of course we really need population-level information about all of these current, but also new emerging variants. Quickly to mention COVID-19 vaccines. On the community dashboard, you can find updated weekly information on the total amount of vaccine being administered in Santa Barbara County, as well as the allotments and the orders that our public health department is working hard on week over week. California is now focused on a simplified age-based prioritization for vaccinations and a move away from occupation-level risk stratification. Santa Barbara County Public Health Department and our local large healthcare systems have recommended a focus really on people thus far over the age of 75, just itself a very large group with the initial vaccine rollout. And there have been a variety of vaccine efforts underway so far with the Public Health Department, big providers, and also small providers across the county. More vaccine will continue to come to the county, and we can, I think, anticipate an intensification of efforts to expand access to all who are currently eligible. And so, pearls, this week, the COVID-19 epidemic in Santa Barbara County continues with widespread transmission as indicated by our purple tier status. We are still with over 2,000 people actively infectious across the county today. And don't forget, over 300 new people are being diagnosed every day just in this last week. So still clearly a lot of infection out there. Large number of people remain hospitalized this week, but that number week over week seems to start to be more stable. Tragically, as we knew would come, we are now seeing the death rate rise. This we knew would come a few weeks after our local surge occurred with our case counts, and we are absolutely, I think, feeling it here in the hospital and around the community. There are some positive signals, both from the governor's office with our 4-week projection, but also just on the data we've reviewed here today, especially our percent positivity improvements and our daily case count improvements. Variants are all the buzz, probably the most important thing to continue to monitor carefully. We know that they're circulating, and we really need to understand better whether they are shifting and changing or remaining relatively stable. Looking forward to big efforts locally and statewide to improve our understanding of this. And finally, vaccine efforts increasing week over week as our public health department and local providers work to protect as many of us as possible and as fast as possible, consistent with the state guidance. I'll finish by saying thank you, and please do remember the reason our curve is turning down is because of you. Please, please continue to wear your mask. We are winning.